I'm so excited to be back here in Rwanda, kind of where a lot of my work with gorillas has also been. I've been working with mountain gorillas for 30 years. So if I tell you how long I've been working with them, you think, she's that old? But yes, I have. And we're excited 2 years ago to celebrate 20 years of conservation through public health. I started working with gorillas because I love animals. I grew up with lots of pets at home, and I'm going to talk about this journey. And then later on, I got involved in wildlife, and I realized that you can't really protect gorillas without improving the health of their human neighbors. So the gorilla you see on the screen is Kanyonyi, one of my favorite gorillas. He was born the year that I started working as the first veterinarian for the Uganda Wildlife Authority, essentially becoming Uganda's first wildlife vet. Also excited that last week we were featured on Call to Earth. So for our One Health approach to conservation and One Health idea, which I'm going to talk how this idea developed and how I would love everybody to adopt this in everything they do. Wonderful for biodiversity conservation and also essential for climate action. I grew up, that's me, I think, when I was 5 months old, on my mother's shoulder. I was the last born in a family of 6. And because I was the last born, I guess they let me do whatever I wanted, because my mom was like, look, my parents were like, she can do whatever she wants. Her elder siblings will look after her. So I was able to follow my passion. I wasn't forced to be a doctor, a teacher, an engineer. I could do what I wanted. And so that's one of the last photos taken with all the family together. My dad was a minister in the first government after independence. I was a baby in the photo. Sadly, he was one of the first people who was killed by President Idi Amin when he came into power because he was threatened by him. And this left a huge dent on our family. So all of us wanted to continue his passion for prosperous Uganda, his dream. My mother joined politics and became one of the first female politicians in the country, encouraging many women to join politics. Honorable Gladys Kalema, and all my siblings did something to make Uganda a better place and the world a better place. And for me, it was my passion for wildlife. I grew up with many pets at home, and I just grew up with the regular cats and dogs, but I got to learn about the mountain gorillas when I set up a wildlife club in my high school, and a warden came to the wildlife offices in Kampala and said, we have mountain gorillas in Uganda. I was like, wow, those are really fascinating. I would like to see them. He said, no, they're not habituated yet. The ones in Rwanda that had been discovered in Rwanda, and the late Dr. Diane Fossey had done a long-term study of, were very well known. And we thought that they were only in the Virungas. But they went and found night nests where the gorillas, sleep every night and defecate in them when they get up in the morning. And when they did DNA studies, they found that they're exactly the same as the mountain gorillas in the Virungas. And suddenly the number of mountain gorillas doubled. It was going to take several years before I was going to get to see them. I got a chance to set up a wildlife club in my high school. That was my first entrepreneurial activity. I was 18 years old. It was a turning experience in my life. It was amazing because we went to Queen Elizabeth National Park at a time when there was very little wildlife, sadly, because during the Idi Amin era and when he was overthrown with the Tanzanian soldiers, they killed a lot of wildlife. The elephants went to DRC. It was a really tough time for Uganda, but I felt a bit sad, and I thought, why don't I become a vet who can also bring back the wildlife? One thing that influenced me, though, even before setting up the wildlife club, is there was a pet velvet monkey that was owned by our next-door neighbor that used to come home and even imitated me playing the piano. So I got to understand how clever primates are. And so finally, I got to study the mountain gorillas as a vet student at the Royal Veterinary College, University of London. We were allowed to work with animals of our choice, and it was a great experience. So I got to work with the chimpanzees in Entebbe Zoo, which was really amazing. And then I finally got to Bwindi. And what struck me was the very hard edge between the community and the park. And this is really important for climate, because I found that suddenly you're there. Like, wow, here we are, the gorillas are here. And they're always coming out of the park because of the hard edge. So this was the first mountain gorilla I saw, Kachipira. It's not a very good photo, but it was a very emotional photo. Because when I met Kachipira, I looked into his eyes and I felt a really deep connection. These are almost one of our closest living relatives. We share 98.4% genetic material. But also, just before I got to see Kachipira, I had to spend 1 week in the mud hut that I was staying in because I got a really bad cold. And so by the time I finally got to see him and we got really close, I realized that actually we can easily make them sick. We were only 5 meters away. And I really felt, he was so accommodating, and I felt I really need to protect these animals. Mountain gorillas are so beautiful. I don't know how many of you have seen them, probably quite a number, because I know it's one of the major tourist attractions in Rwanda. They live in family groups. The father is very protective, just like the mother. They live in a harem. The mothers are very motherly. I've learned how to become a good mother because of them. We have 2 sons. I've learned so much about the gorillas. They eat a lot. They spend most of the day eating, sleeping, resting. I really got to learn so much about them. Also being at the tourist site of Bwindi and seeing how tourists are really supporting conservation efforts. So, and then finally, I convinced the executive director of the national parks to hire me as their first wildlife vet. And I came here in Rwanda 1 month before I actually started officially working. Dr. Liz McPhee in the photograph used to work here with the Mountain Gorilla Vet Project, and she invited me over because she had supervised my research. She said, there's a gorilla with a snare, would you like to come over? So I did. And then I met someone else who had a lot of influence in my life, a great mentor, Dr. Tony Mudakikwa, who was the first vet for the ORTPN. And we removed the snare from that gorilla, that baby gorilla here in Rwanda. It was a truly memorable experience. Then I got to Uganda, and 9 months into the job, they told me that the gorillas are losing hair and developing white scaly skin. So I was like, what could this be? The vets in Rwanda hadn't seen it in the gorillas. So I spoke to a human doctor friend of mine who also studied in the UK, and I said, what is the most common skin disease in people? And she said to me, it's scabies, sarcoptic mange. And I said, you know, we have gorillas with these symptoms. She said, take a bottle of ivermectin with you, because it was a 10-hour drive. It turned out that it was scabies, and this juvenile gorilla was scratching, even under the effects of anesthetic. And this made me realize that, you know, this was a very itchy disease. The baby gorilla actually died. Sadly, we lost the baby gorilla because the mother would not allow us near her on the first day. And even when the next day she dropped the baby. And it was very sad. The baby had died, but the mites were still alive. And that's how severe it was. And the baby also had pneumonia. Later, we started to ask ourselves, where did these scabies come from? Remember the hard edge I talked about? Where as soon as I got to Bwindi, all gorillas that in Bwindi we were finding, once they lose their fear of people, they start to go back to the places they used to range before gorilla tourism began. And they would find people with dirty clothing that they put out on scarecrows to chase away gorillas, baboons, and other wildlife. And that's probably how they picked up scabies. So everybody turned to me, being the only vet in the organization, and said, you need to set up a health education workshop for the local communities. So that was the next turning point in my life. We developed brochures in English and the local language, and we started doing this work. And when we met over 1,000 people in 8 villages, we found out that people could not even get to the health center when they were sick. They had to be carried on stretchers over a long journey, and some of them never made it. But also people had better solutions than I was proposing for them. A lot of them said they wanted health services to be brought closer, they wanted more health education, and they wanted to strengthen the team, the human gorilla conflict team that herds gorillas back when they come out. And I also got to meet a lot of people along the way. These little boys were supposed to be in school, but they're herding goats. So as long as you had people who are unhygienic and poor, the wildlife and the people were always going to be compromised. So we started thinking about improving the health of the people and reducing human-wildlife conflict. When gorillas go to people's gardens, they actually destroy their livelihoods. So as much as tourists think they're cute, the local community doesn't think they're cute. We also had many other cases, and we didn't know whether the gorillas got a rectal prolapse by picking up human fecal matter, like parasites. And so this made me feel that we need to set up an NGO that improves the health of the people and the gorillas together. And so we started conservation through public health in 2003. And as you can see, when you protect gorillas, you protect the habitat. Once gorilla tourism began, people could not cut the forest anymore. So we have a climate modulator here, a very important Afro-maintained forest, which also protects other wildlife, chimpanzees, pangolins, elephants, birds, butterflies, duiker, bush pig. It's an amazing ecosystem and a very important water catchment area. We keep monitoring the health of the gorillas. We collect samples from them every month and look for diseases that they could get, maybe going into the local community. They love the bark of eucalyptus trees that they get communities to plant so they don't have to enter the forest. And we work with the local communities to collect the samples and the rangers, and we carry out a lot of scientific research and monitoring to make sure that the gorillas are not picking up parasites from people or livestock in the area. We started behavior change communication, which is beyond education. We work with village health teams and teach them to do conservation work. So we coined the term village health and conservation teams. So as they're going out, carrying out community-based healthcare, they also promote conservation education. And we're excited that this has led to a lot of empowerment. When I first went to the communities to talk to them, a lot of the community said, we need to educate our daughters. This is a woman leading a team of men. But now I'm excited that the women stand up and give talks in their communities, and they're really changing their communities. And we carry out a lot of behavior change, we promote family planning, and we keep on reducing human-wildlife conflict. Family planning, they actually give injections to women in the comfort of their homes. And this became a national policy, which I was very excited about, when it teamed up with Family Health International. They talk to people about having good health and hygiene, having hand-washing stations outside the toilet. We started off when it was only 10%, but it's gone up to over 75%. They talk about good nutrition, sustainable agriculture, how to access ecotourism revenue so that it's more equitably shared, because some of it is shared with the local community. They talk about the dangers of eating bushmeat and how not to make the gorillas sick, being healthy and hygienic. And this lady, Rehema, is training another 4 women. And so now we have 430 volunteers, reaching over 50,000 people in 10,000 homes around the national park. We support them with village saving and loan associations and livestock projects, so they keep going even when we're in between donor funding. And we also stretched and expanded our efforts to DRC, where people are even poorer, and they really wanted to embrace family planning as much as it was a largely Catholic country. When we found out that many people are unhealthy because they're poor, we decided to also support coffee farmers in the park, bordering the park. I'm here with my husband, Gladys Kalema-Zikusoka, who gave me this idea. He's a founder member of CTPH. And so we found out that whenever you check on the gorillas, you often cross coffee farms, but these farmers were not getting a fair market or a steady price, and were still entering the forest to poach and collect firewood. So we decided to develop a global coffee brand to save gorillas through coffee. So we give the farm, we only buy the best coffee. It has to be premium or specialty. And we sell it to the lodges, the tourists. They're always excited to support these farmers. And they're excited to see a coffee tree. Most people haven't seen coffee. They only see it in a cafe or in a supermarket. So it's part of the tourism trek to the gorillas. And we're excited that even during COVID, this lady in the photograph, Vicky, was able to buy coffee and stop farmers entering the forest to poach, because we were able to export it. And a donation from every bag sold goes to support the community health and gorilla conservation efforts. And we're excited that it won 92 points in coffee review in California, and I was among the top 30 coffees they reviewed. So it's great coffee. We're just trying to get all the farmers to grow good coffee. Gorilla tourism is something that has helped to bring the gorillas back, to increase their numbers. Mountain gorillas brought tourism back to Uganda after tourists had disappeared during the Idi Amin era. And these are tourists visiting the gorillas, following the regulations. They're 7 meters away from the gorillas. We're excited that the number of mountain gorillas has continued to grow. I participated in the first gorilla census in 1997 when we counted 300 gorillas in Bwindi to add to the 350 in Virunga to have 650. And this month, we're going to have the next census. So we hope that the numbers will keep growing. But during COVID, we're concerned about another threat. Just as we can easily make each other sick by being near each other, coughing on each other, it was even worse for the mountain gorillas. So we advocated that everybody should wear masks when they visit, and it's happening now, and all over where mountain gorillas are found, where gorillas are found all over Africa. And in fact, they found that in Rwanda, the government found, and the NGOs here found that there was less flu in the gorillas because during the pandemic, because now everybody had to put on masks. We carried out a lot of education using the same methods that we had used all through with our groups. But sadly, we lost a gorilla during the pandemic by a hungry bushmeat poacher because tourism disappeared overnight. The communities were over-depending on tourism. And so we started a program of fast-growing seedlings so that they can always have something to eat. And this has also continued beyond the pandemic. And one thing we've continued to advocate to tourists is that it's not enough to visit the gorillas and go home. You should visit a community member, buy a craft, take them to be your porter when you're going up those steep hills. Do something to support them, because when a community member meets a tourist, they're much less likely to poach. I've been honored to become a UNEP Champion of the Earth in Science and Innovation for a One Health approach to conservation in 2021. And I really emphasized, thank you, I emphasized the need to have more local champions, because if you do have them, then even when they become members of parliament, they'll make the right decision. Right now, we have an issue where in Uganda, they want to cut down trees to plant sugarcane in Bugoma Forest, which is a stronghold for chimpanzees. But if you have enough people up there who care about the wildlife and the environment and climate, then you don't have to have those debates. I was truly honored to be among the BBC 100 Women in 2023 and among the 28 climate pioneers. Thank you. So my take-home message from this talk is we cannot protect the wildlife without making sure that people are healthy and their well-being needs are met, and they're the ones leading the efforts in their communities. It shouldn't be outsiders. It needs to be the local communities leading the efforts to make sure that the wildlife is safe and healthy. I wrote a book about my conservation journey called Walking with Gorillas. I'm excited that a hero of mine, Dr. Jane Goodall, wrote the foreword. I met her when I was a vet student. She invited me to Gombe National Park, where she started her groundbreaking work on chimpanzees. I still haven't been. But we work closely with Jane Goodall Institute in Uganda. She's now branched out from only looking after chimpanzees to supporting the communities where chimpanzees are found. Excited that Rwanda were one of the first to talk about the book, and it's available in Ubuntu bookstores and also at the airport in Kigali. Thank you so much for listening, and hope you get to visit the gorillas.